In this video, we want to discuss another important topic on medical genetics, and that is blood group system, and medical conditions associated with blood group system. Yes. So to kick off, we want to look into some definition of terms very important in this topic, and that is one, blood, two, antigen, and three, antiserum. And that is what we have on the blood. For the blood, which is the first one, you watching the video may have many views you have, many views you know, many things you know about blood. Yes, a lot of people define blood as a fluid which carries oxygen and other important nutrients around the body, and in turn carry carbon dioxide and other waste products away from the body. Another person can also define blood as a fluid which contains red blood cells, white blood cells, blood platelets, and other substances suspended in a fluid called plasma. That means we have many ways we can define blood. Yes, depending on where someone is coming from. Another important term we want to discuss is antigen. Antigen, that is another point. Is defined as molecules, usually proteins, that will induce an antibody or immune system or immunoglobulins to act when the antigens are introduced or inoculated into an animal. That means that an antibody is simply immunoglobulins or your immunity, your immune system which acts or which get activated when the antigens are introduced or inoculated into you. Yes, that means antibodies are like immune system which fight for us against foreign agents which try to what attack us. Yes. Now, it is important to know that this antigen we talk about is located on the red blood cells, whereas the antibodies are located on the blood plasma. Yes. And so, when we talk about antiserum, we call it antibody-rich serum. Antiserum is simply called antibody-rich serum. We say it is a blood serum that contains specific antibodies against an antigen. You see, foreign agent, that means antigen in a layman understanding simply mean foreign agents on your body. Okay? Now, it's important to note that antigen A in the red blood cell and antibody B in the blood plasma. Yes, this is when you can say that somebody is having blood group A. This is for blood group what? A. Once antigen A means antibody A, reaction will take place. And that reaction is what we call clumping or agglutination. And this is the rationale used in checking blood group of an individual. Now, let us see how to test and know the blood group of an individual. You have a patient or you have an individual, you want to know his or her blood group. How do you do that? To do that, you get three circular plates. Now, there is what we call antiserum, and we say it is a blood serum that contains specific antibodies. So we get antiserum A or antiserum A. That means antiserum A, which means antibody rich serum A. It will be fighting antigen A because it is A. Recall, antigen will be coming from your what? Red blood cells. Your cells or your blood that will be taken from your what? Tongue. Now, you put antiserum A. Once you put antiserum A here, and you now take your blood and drop it here as well, mix it. If there is agglutination, if there is a reaction or agglutination or clumping, note it that there is agglutination. Then when you also put here antiserum B or antiserum B, you come here, you put antiserum B. If after putting the antiserum B and you carry your blood and drop here, and there is no clumping, no reaction, no agglutination, put negatives. Here you put your what? The Jesus reagent. Now this Jesus reagent, if there is reaction here in the Jesus reagent, you put what? Plus. Now because there is reaction here, the reaction came up because we have antigen A, and antigen A reacts with antiserum A. So you call the individual blood group A individual. A positive. Blood group A individual versus positive. See how we write it. Blood group A versus positive. That means this is the blood group of that individual. Then, if as you put your antiserum here and put your blood here, the blood of the patient here, and no reaction, you put antiserum here, you put the blood here, and there is reaction or clumping or agglutination, and here there is reaction. What you call is that the reaction came up as a result of antiserum B is reacting with antigen B, and so the antigen B, which you realize that it is what is in red blood cell of the patient, will make it to be that this will now be blood group B versus positive. Now if there is reaction here and there is reaction here, clumping here, then clumping here, you say that this will be what? AB. That is, it has antigen A and antigen B, Jesus positive, and that is blood group AB versus positive. Are you getting it? Now another point is, if there is reaction here and there is reaction here, but there is no reaction here, here will be negative. You come here versus negative. Then if there is no reaction here and there is reaction here, this reaction coming up here is as a result of antiserum fighting with what? Antigen B. So it will be blood group what? B versus negative. Then if there is no reaction here but there is reaction here and no reaction here, it means that blood group what? A, because the reaction is as a result of antiserum A fighting with antigen B in the red blood cell. So blood group A versus negative. But what if there is no reaction here, there is no reaction here, and there is no reaction here? That is when you talk about blood group O. Blood group O do not have antigen A and antigen B, but they have antibody A and antibody B. And so we say blood group O versus negative. Yes, the rhesus antigen is coming from this rhesus we'll talk about. Yes, rhesus negative. Then if we have no reaction here and we have no reaction here, but we have reaction here, we say it's blood group O versus what? Positive. That is, there is an antigen from rhesus factor. From this rhesus, there is an antigen in that person's blood from this rhesus. Then if there is reaction here and there is reaction here, and here is there is reaction here, we say it is AB. This AB means that they are having antigen A and antigen B, but no what? Antibodies in it. And you also have antigen from rhesus, the blood group AB rhesus positive. Yes. But if there is reaction here and there is reaction here, and there is no reaction what? Here. We say it's blood group AB rhesus what? Negative. And it is important to know that blood group AB are called universal donor, universal recipient, please. They receive from all blood groups. But blood group O is not to be universal donor, especially blood group O negative. Yes, because they do not have antigen from the rhesus, so they can donate to every blood group. But blood group O positive only donate to most positive blood group, that is A positive, B positive, AB positive. That is what they donate to. Next to discuss is an important genetic disease condition medically associated with blood group, which is known as erythroblastosis fetalis. Yes, this disease condition has affected a lot of young ladies, young girls in this life. Take for instance, when a woman is pregnant, a young lady is pregnant, and that young lady is blood group O negative. Every blood group O negative is very sensitive to come up with this disease condition, and that is why every blood group O negative, when pregnant, should register with the hospital, especially when the blood group of the baby is found to be O positive. That is, the pregnant woman is blood group O negative and the fetus or the unborn baby is blood group O positive. This is a serious medical condition. This is a serious medical issue. And so, when a pregnant woman is blood group O negative, he has to get registered with the hospital to see that issues will not come up with her pregnancies. Yes, the reason is because when a pregnant woman is having blood group O negative, that means the rhesus antigen is negative. It does not have rhesus antigen, but it has antibody A and antibody B in the blood plasma. And you know that the blood of every baby or blood of every unborn child, blood of every fetus comes from the sperm of the father. And so, as the blood group of the baby is O positive, is a very big challenge because this blood group O positive has rhesus antigen as well. And so, as this mother is carrying this unborn child, as the mother is carrying this fetus, this pregnancy, as this blood sense that this fetus is carrying is having O positive, that is, has rhesus antigen in his blood group, there tends to be a reaction between the blood of the mother and the blood of the baby. Yes, because there is rhesus incompatibility. And this reaction is not too serious in the first pregnancy. It's mostly not too serious in the first pregnancy. But caution has to be taken and medical intervention has to be taken. And that is why the pregnant mother have to register with the hospital so that as he's carrying the baby, within 28 weeks of carrying the baby, he needs to be given a drug called Reogam. This drug called Reogam in the market or in the pharmacy is sold as Anti-D. The market name is Anti-D. This Anti-D is quite expensive, but it is this drug that will do the work of trying to take care of the reaction that will take place between this blood of this mother and blood of this baby, which have rhesus incompatibility. So he has to take the drug within 28 weeks of the pregnancy and within 72 hours after delivery, so as to be able to what take in and have baby in the subsequent pregnancy. Yes, if the pregnant mother with this blood group O negative and fetus or the unborn baby O positive fail to get registered with the hospital so as to be taken care of by administering this drug to counteract the reaction that is going on about to be severe, the implication is that it will get severe and more severe after delivery of the first baby, and as e gets more severe it will result to that disease condition called erythroblastoma fetalis. That is, it will be very very difficult for the mother to take in again unless by divine intervention, and if it takes in, there will be strong reaction, and that reaction will result to hemolysis, miscarriage, and will not be able to survive it. And so unless with divine intervention that he can survive it, but medically he will not survive it.